Good morning, CAC students, and welcome to a health and safety discussion for your Workplace Practices course NSCI 3795 in the New Zealand Certificate in Animal Care. Health and safety is a very important part of working in an animal facility. I'm just presenting this, which Laura Harvey wrote. Now Laura, and there's her email, is responsible for our vet nursing program, so she might be a person you want to contact and get to know. Thank you for sharing this with us, Laura. Health and safety at work has been a problem for a long time, and the laws have been made better and better over time in order to protect workers. In terms of where we stand now, the new legislation that was enacted in April 2016, obviously written in 2015, is the current paradigm. The aim is to further reduce our work-related injuries and deaths, because New Zealand had one of the worst rates of injury and death in the workplace in a first world country. The aim is to reduce harm to workers by at least 25% by 2020, and it's all important that you guys buy into this, because health and safety in the workplace is not an option, it is compulsory. It affects everybody who works in any given workplace, as well as volunteers and visitors to a site. So, for example, if you have a vet clinic or an animal unit, and you have a hazardous situation and people visiting, you need to keep them separated from the hazards. You need to make sure your visitors, your volunteers, your paid employees are all kept safe. And obviously, if we look at where you fit into this, you are both students and volunteers in your external work placements, and it's very important that you learn to interact with all of this kind of law and practice as you go. So this is quite important for us to talk about. Overview of health and safety protocols. It's all about health and safety at work. Think about health and safety duties also. We will talk about how people should engage, how you participate, and how workers are represented in the process. We also think a little bit about enforcement and other matters, and health and safety covers various provisions such as using the correct equipment and minimising hazards. We'll talk about all of this. Purpose of the Act was to provide a balanced and secure framework under which workers can have safe workplaces. And the aim is several-fold. We're protecting workers against harm to their health, their safety, welfare by eliminating or minimising risks. So obviously, if you cannot remove a risk, you have to minimise or isolate it. We need to provide for fair, effective workplace representation, so that workers are consulted with and that they cooperate with the whole process, and issues can be resolved in relation to health and safety using the protocols. We encourage promotion of the improvements in health and safety as part of what we're doing. So this promotional stuff that you see on TV, it's important to you, and we're promoting it here as well. So this is part of the role of health and safety in the workplace, is to promote the right approach to it. Promoting for the provision of correct advice, information, education, so that's exactly what we're doing here, and training in relation to workplace health and safety. And also the Act aims to secure compliance through effective compliance and enforcement measures and protocols within the law. And then to eliminate the risks to health and safety where it's reasonably practicable, and if you can't if you can't eliminate a risk, you minimise it. And you can also isolate as another term that you might find from the legislation. So generally speaking, we need to do everything that's reasonably practical to actually manage risks in the workplace. Reasonably practical means you don't have to do everything that's humanly possible, because it may not always be pragmatic. If you need to get a job done, you might have to think about carefully minimising or eliminating the risk that can't be eliminate the risk or minimise that you can't eliminate. And because something is possible, it doesn't mean to say it's necessarily the right response. So, for example, paper cuts is in the cartoon below. And arguably paper cuts globally might be worth $1 million a year from lost time, death of people, 150 people. Is it worth $1 million? It's quite an interesting cartoon. I think it's obvious that you have to make sensible decisions about where to apply the protocols, but it's very important to avoid death and serious injury under these protocols. Everyone who works in any kind of industry, but in particular in our case, in animal industry, has a duty to take care of your own health and safety, and also you have to make sure that your actions or lack of actions do not adversely impact other people's health and safety. And you need to comply with the health and safety legislation. It's not optional. It's important that if you're doing work that requires training, that you get adequate training and supervision while you're learning, and if necessary, you are trained how to use the personal protective equipment properly and appropriately. Sometimes if you don't use protective equipment properly, it doesn't work. And also you need to think about how you can inform other workers or share information when certain tasks that require training and supervision are carried out. So how do you actually warn other people or look for warning signs in machinery at workstations, for example, if something's wearing out and could cause an injury? You need to understand how to prevent injury. So sometimes it's just a maintenance issue like this. Personal protective equipment is required to minimise risks to health and safety when they can't be removed. And unless a worker willingly provides their own, it's the requirement of the workplace to do so. So a worker may have their own steel cap boots, for example, which might be preferable to using some that are provided by the workplace. It's not so comfortable wearing someone else's boots, but in a situation where, for example, you need a respirator mask or a dust mask or gloves or gowning, as a rule, it should be part of the workplace's provision for you. And the law actually has various clauses that interact with employment law and require for allowances, for example, for protective clothing if it's a permanent part of your requirements. Young people under the age of 15 may be restricted in terms of some industries, so construction, logging, and hazardous substances. Young people 15 or under are not permitted to work in these environments. I don't know if you're aware that the minimum age for leaving school is actually 16. So the principle here is that if you're under 16, you should probably still be at school, and if you're doing a part-time job, it should not expose you to these kinds of hazards. And as a side point here, we don't permit young people, perhaps your children, into our animal unit because we can't take responsibility for their safety while they're there. So it is important that you recognise this, and let's say you have a sick child and you can't get to your work experience, phone in and explain, because it's not acceptable to bring children into the workplace in most cases. The facilities who employ you or provide volunteer work have a requirement to provide a space for you to work in safely. So, for example, if the spatial arrangement in the workplace was inadequate, that would need to be sorted out. There needs to be a safe evacuation route in an emergency. If you're working with volatile chemicals and inhalants, there needs to be suitable ventilation. You should have toilets provided. You should have access to clean drinking water and hand washing facilities. Excuse me. And there should be somewhere for the workers to eat and take breaks, and that should generally be outside of the area of any hazards. First aid. A workplace providing either volunteer or paid work is required to provide an adequate first aid equipment suitable to the nature of the environment, which is accessible to workers, and there should be trained first aiders on site at any given shift, and how many of those are required might depend on the size of the workforce. Some offences can cause people to be seriously penalised by fines. So if a worker is shown to have breached health and safety protocols and caused, primarily these offences apply when this caused a serious injury or death, then the fine can be up to $300,000 or a 5-year imprisonment. The employing organisation, if they are found to be guilty of breaches of health and safety resulting in serious injury or death, the fine can be up to $600,000 per incident or 5 years imprisonment. And an interesting point here to remember, I don't know if you remember the canyoning disaster where we had 7 deaths of school children. The Outdoor Pursuit Centre at that time was fined $200,000 per breach. because the law has changed, they've upped these fines. So it's a very big issue if your workplace is not appropriately following health and safety procedures in terms of financial risk as well, and this would put anyone out of business, I think. Notifiable injuries or illness. There are a range of different injuries or illnesses that should be treated immediately, and other than with first aid, we're talking medical treatment by a doctor or a hospital. So these are notifiable or serious injuries. The amputation of any part of a body, serious head injury, serious eye injury, or a serious burn. Any separation of the skin from an underlying tissue, for example, degloving or scalping. I'm not sure if you're familiar with those terms, but you have a look, essentially ripping the skin off. So, for example, grabbed by a machine. A spinal injury, the loss of body function, such as serious lacerations. And these all obviously require hospitalisation or immediate treatment by a doctor. Any injury or illness that requires hospital admission for immediate treatment falls under this category. It may not be one of the listed ones. An injury or illness that requires medical treatment within 48 hours of exposure to a substance, which could include infectious microorganisms. A serious infection caught while carrying out work, so microorganisms are a big issue. Treatment provided or care to a person due to exposure to a hazardous substance or a microorganism, anything that involves contact with human blood or bodily substances. And with this sort of thing, we're talking risk of diseases such as hepatitis or AIDS or other problems. Anything that involves handling or contact with animals could be high risk. Animal hides, animal skins, animal wool or hair, animal carcasses, or animal waste products. And the main reason for this is zoonoses, which we'll be talking about in the current conversation with other courses as well. Anything that involves handling or contact with fish or marine mammals is potentially notifiable, could cause an infection. Be aware of fish, they can be disease-causing to humans, or any other illness or injury which is notified in the regulations as a notifiable injury or illness for the purposes of this section of the law. So there's a whole range of different causes here that may end up being a breach of health and safety, which would then require an investigation. Obviously, a serious injury requiring hospitalisation or a doctor's treatment straight away is a good criterion, but these other ones that are a bit below the bar could include infections by microorganisms that you contact in the job. So, for example, if you contacted ringworm fungus off a cat or a dog in your care, this is arguably notifiable, and the method for notifying is placing it within the hazard register and accident register in the health and safety files in the workplace, and usually reporting to ACC. Notifiable incidents. This is an interesting concept in the law. So a notifiable incident means something that wasn't expected or controlled for in relation to the workplace that exposes a worker or some other person to serious risk. It may not necessarily result in actual injury. However, a notifiable incident needs to be dealt with, and an immediate response is required. For example, the escape of an animal, a spillage, a leakage or something of a substance which may be toxic, or an explosion, implosion, or fire as a consequence, for example, of release of a substance, a gas escape or stream of gas, an escape of a pressurized substance, and this could include steam, for example, which would be compounded by heat, electric shock, which may not necessarily result in serious injury, but you would need to follow this one up with a doctor's check at the very least. A fall or release from a height of any plant, material, substance, or thing. When we talk about plant here, we're talking about, let's say, a piece of equipment. The collapse, overturning, or failure, or malfunction, or damage to any part of the plant, remember that could be equipment, or actual fittings, that is required to be authorised for use in accordance with the regulations. So a piece of the plant might be a fitting that is part of a safety system. So collapse, partial collapse of a structure, so obviously this is a building issue. Collapse or failure of an excavation, so this is a process, or any shoring up or support of an excavation. And this brings to mind the death of a worker in an excavation on a building site in Auckland a few years ago when it collapsed. So these sorts of things are actually based on real incidents. They may seem the wording of the law is a little bit obscure, but it's actually based on real incidents. We've got inrush of water, mud or gas in the workings or an underground excavation or tunnel. Interruption of the main system of ventilation in an underground excavation or tunnel, so these are quite extreme, and a collision between two vessels, the capsize of a vessel, or the inrush of water into a vessel, in which we mean a vessel is a boat. So these are examples. Now, you might need to think outside the square a bit to apply this to our workplaces, but we'll see how that goes. If something is a notifiable injury, illness or incident, it needs to be communicated to WorkSafe, and it needs to be recorded in your system. And any result to do so, any failure to do so may result in a fine. And the fines are up to the levels we've mentioned already. Keeping a record. So this is quite an important part of it. If you have a notifiable event that didn't necessarily result in an injury, but let's say something collapsed, or your steam boiler exploded and released steam. Fortunately, no one was hurt. It's still something that needs to be notified. The reason for notifying such an event is in order to understand why it happened and prevent it. And the forms are available on the WorkSafe website. And here's an example. This is notification of a death or notifiable injury or illness, so we're talking serious injury here. And at Unitec we also have a recording system which will be used if we have a serious injury. Notification of a notifiable incident, so this is the non-injury, but the incident that could have caused an injury if it was just a less fortunate time or place when it happened. So a potentially dangerous incident is also reported, and normally you also need to formulate a plan to manage that instance in the future within the workplace. Who's responsible? Well, the simple answer is everyone here, but these rules apply to anyone on a workplace. The employer is first and foremost responsible for managing the whole place. So the managers have responsibility for working with health and safety. You can designate someone to do that. The organisation, in a broader sense, could be liable if it's not managed properly. So it's very important. For example, a big organisation like SPCA could be in quite a lot of trouble if they don't follow health and safety rules. And you'll find at very formal organisations like the SPCA that the health and safety protocols are much more obvious and much more thought through and taught to you when you start there. As a volunteer or an employee, you are a part of the health and safety chain. It's critical that even a volunteer engages with health and safety, which means talking about the right way to do things, learning the right way to do things, and also using appropriate protective equipment when it's required. Normally there's a designated health and safety manager in a lot of businesses. It's actually not an absolute requirement that one person do it. There could be a team, but generally speaking that will also be proportional to the size of the workplace. So if you have a very big workplace such as Unitec, you're going to have a chain of command within your health and safety management process. So for example, Laura is our health and safety manager for the department, or our pathway as we call them these days. And these managers are part of the process. Also the safety representatives would be employees who are involved in the process and take a part in discussing health and safety matters. In terms of managing risks, this is quite important, so I'll go through it maybe a couple of times. We have a 4-step process here which involves identifying what the hazard or risk is. And for example, if you had a notifiable incident without an injury, that would be an opportunity for you to identify what is the hazard that you need to manage. So why did the boiler explode? Fortunately no one was nearby, but we need to understand why. Was it a failure of some safety check or equipment, and so forth. You then assess what has happened, what is the risk incurred here, what is who could be exposed to this hazard, how much could they be harmed, and how could they be harmed from the hazard, what could happen if the harm does occur, so what's the likely outcome. That might involve working with electricity. The hazard is unsafe equipment. The harm could be an electric shock. It could actually be as serious as electrocution. It has to be managed, and so that's the next step. You need to work out what to do. So, for example, with the electric situation, you need to make sure your equipment is certified and safe. You need to reduce any serious harm. You need to prevent or reduce the chances of harm occurring at all. So you can reduce the seriousness of the harm, and you can also prevent harm from occurring. There's different levels. You need to decide how to deal with the risk. If it's possible to eliminate it, so remove the hazard, that's a great outcome. If you can't eliminate it, then you need to minimize it or isolate it. So you could minimize the hazard by putting control measures in place, by limiting access to it, by using appropriate health and safety equipment when you're in the place where the hazard exists. And then you need to monitor this. So let's say you've had an event, and that's caused you to think about assessing and managing the hazard. You need to then come back every so often and actually see how effective your measures are to actually manage the risk. Is it working? Are people behaving appropriately towards the risk, and are they following your protocol for managing it? And you need to think about that on a regular basis. Depending on the level of risk present in workplaces, it's quite common to have frequent meetings at high-risk workplaces such as construction sites, and that would identify new risks and discuss with workers how it's going to be managed. And then you keep an eye on what's happening. So the process is quite important. You've identified a hazard, you've worked out what the hazard is, how it could affect people. You make a plan to manage it, if possible to eliminate it, but if not possible to minimize or isolate the hazard. And then you monitor whether it's going to, people are actually complying with your plans. In terms of managing risks, the best way to manage a risk is obviously elimination. But pragmatically, that is not always possible. So there are a number of ways to minimize. So substitution of a risky process with something that is less risk, either wholly or partly, may be one example. Isolating the hazard, so keeping it in a place where it's of less risk or people are less exposed to the risk. Having controls of the hazard, so you engineer ways to control it. You could have administrative controls, which might be include teaching people how to deal with it, for example, or only having certain people exposed to it. That's going to combine isolation with training with and other measures. And working with personal protective equipment where that is obviously identified as an appropriate measure. Personal protective equipment often works with other levels of management, and it's often one of the first things you put in place. In terms of managing the risks, there's the process again. Identify the hazards, so think about the activities the workplace needs to do, understanding what's happening here. We will do some examples of this, just a normal day-to-day process, walking through the Unitech small animal unit, looking at different situations and considering, who works here? What are they exposed to? Is anyone particularly vulnerable, for example, pregnant woman? That would be a good example in a situation where, for example, inhalant chemicals might be present. It might be appropriate to isolate pregnant women and young people from that place. Considering whether or not the worker's general health could be affected, quite important in identifying the hazard. You need to look at the hazard, tease it apart, look at the nature of it and how it affects people before you can actually make a proper risk assessment. That's step 2, you're working out what risks you can manage, what risks you can eliminate by removing them, and then you work out a protocol to get there, to manage the risks. So you decide which risks you want to deal with first, what's the highest level, and you obviously have to engage with the workers when you are assessing the risks so that they understand where the risks are and they understand how you're dealing with them. And it's actually a positive move that workers are involved in the process and trained to help managing risks because they become more engaged and more part of the process. When you manage the risks, you're going to decide how to deal with it and first consider whether it can be eliminated. So can you get rid of the whole problem or not? And if it can't be eliminated, how are you going to manage it? And you can think about those different levels of management that we saw in the previous slide. And then you can monitor the control measures. Are they working? Are people better off? Are they safer than they were? And make it part of your normal business activity that people live with, literally live, the health and safety process. And it's important for you guys when you're starting out in the workplace or you're going into other people's businesses that you really buy into what they do. You become part of their culture. And this process is constantly reviewed because the risks in a workplace can change over time based on all sorts of things. Someone moves a barrier and all of a sudden the risk is back up there again. You need to identify that the barrier needs to be kept in place and maybe put a sign on it so that it doesn't get moved again. So identifying hazards, we'll take this apart one piece at a time. All the existing hazards within the working environment should be identified in a systematic process. And you can make a list of hazards or potential hazards in the workplace. And remember, the hazard is often just in the potential. It hasn't become a hazard until it actually happens. You could look at things like the worn cord on a jug, the presence of dogs, perhaps aggressive dogs. You need to look at area by area. So, for example, the office may have different types of hazards to field work or travelling for purposes of work. When you're driving along in your private vehicle, you're covered by other laws and you're not part of a health and safety protocol. But if you're driving a work vehicle, believe it or not, you are now under the health and safety laws based on how that vehicle's used, what it's used for in the workplace, and there needs to be a consideration of how you make sure that people are safe when they're driving. When new hazards arise, they need to be added to the list of hazards that you're managing, and you'd keep a register of hazards in a file in a place where people can find them and people know they are. You don't want this hidden away. And everyone's responsible in the workplace. So if you see something that might be a hazard that hasn't yet been identified, you notify your supervisor or safety manager and you start the conversation about how to deal with that. The basic principles here, we identify all the hazards, we make a hazard register or a list of those potential hazards, and we keep adding new hazards to that as they crop up. A hazard is defined as anything that includes people's behaviour. So, for example, where that behaviour has a potential to cause death, injury or illness to another person, whether or not that behaviour results from physical or mental fatigue, drugs, alcohol, traumatic shock or other temporary conditions. So, for example, coming to work too tired because you spent too long watching the America's Cup, great race, still is potentially a problem. If you're doing physical work, you're too tired to do it carefully and safely, you are now a hazard to other people. And the same applies to things like drugs, alcohol, and those kinds of things that affect your ability to perform your task properly. Hazards need to be identified and notified, so you need to be aware of warning signs such as these. You need to have exits clearly marked in any building. You should be told on your first day in the workplace where the exits are as well. If there's hazardous equipment being used, a sign should be used to explain that. So you're in a warehouse, there's a forklift being driven around. You might not be able to see the forklift right now, but you should be aware that it's there. High visibility clothing, very big part of these laws now, and you'll notice most of the commercial drivers on the road these days have simply got high vis built into the t-shirts and clothing that they wear. It's not something you now put on over the top, it's actually part of your clothing all the time when you're in the workplace, particularly building sites, heavy lifting and moving such as logistics, and so forth. In the sorts of workplaces we work in, flammable liquids, so for example that jar of ethanol in the lab, or it could be a toxic liquid and so forth, they need to be identified. And the next label is an interesting one, the emergency shower. We're going to see that when we're in the biology lab, that we have emergency showers and emergency equipment signposted and clear. You'll see this in most places you go to. Another component of health and safety, which is really important, is training, and this particularly applies to you guys as volunteers when you start in a new workplace. Training should be recorded and the records stored with your hazard registers. When the training happened, who attended, who conducted the training should all be part of the record. And a person who has been trained signs off the tasks when the training has been successfully completed. And that might include your general safety procedures in your animal care facility that you're doing your work placement in. You're going to do this training and you're actually going to formally sign it off, and you're going to give me a copy and you're going to give the workplace a copy, and you'll get to keep your own copy. In this case, it's for your knowledge and understanding as much as anything. An essential part of training is informing every person in the workplace what to do if an emergency situation arises at work, particularly fire, earthquake or serious injury to a fellow employee as a result of an accident. The first sort of couple there are more obvious, so fire escapes are identified, assembly areas are identified, protocols for an earthquake becoming more and more part of our everyday thinking in New Zealand should also be discussed. And also protocols for injuries that happen, for example, in the lab. In that one, you come to Sophia or you come to Christina. So of particular importance to you guys is training, particularly of any employee, including workplace experience volunteers such as yourselves, must be notified of hazards and how they are controlled. This is an essential part of training. Examples include vehicle use. So, do you know how to drive a quad bike? Is that enough? In New Zealand, you have to be certified to drive a quad bike, and you must not drive a quad bike unless you have got the right training and you're all signed off. Otherwise, you could get into serious trouble or get your workplace into serious trouble if you have an accident. Animal behaviour and handling and zoonoses. Now, we're going to talk about zoonoses a bit more in other lectures or in other courses. That's an infection you get from an animal. Also, obviously, animals can scratch or bite, so handling them properly and understanding their behaviour or demeanour when you're handling them is a critical part of training, especially around animals. So this one's very pertinent to us. And also understanding how zoonotic diseases are transmitted and using appropriate measures to prevent that, such as hand washing, wearing gloves at need, and so forth. A classic issue in a lot of workplaces, and a very high rate of injury, I might add, in New Zealand, is from heavy lifting or moving heavy objects. And a rule of thumb, if the thing is more than 16 kilograms, it is arguably a two-person lift. The cut-off used to be 25 kilograms, but they've brought it low, so it's much easier to make sure people don't injure themselves by trying to be a hero. And if you've ever seen a builder on a building site with a couple of bags of cement on his shoulder, sauntering around as if there's nothing there, that's actually stupid old school behaviour. No offence, but it is poor behaviour in context of workplace safety. Obviously, use of chemicals and drugs, also very careful how we do this. If you're working with dangerous chemicals and drugs, then they have to be handled carefully. So some of the drugs in animal environments could cause harm. For example, anaesthetic drugs could cause harm, especially to pregnant mums. Also, noise and environmental hazards. And I'm not talking noise in terms of having your iPod turned up too high, although that's a big issue if you're working with a machine and you can't hear noises because of your iPod. But noise levels from equipment and plant in the workplace. And environmental hazards includes not just noise, but it could include chemical exposure, electricity, and a whole lot of other issues. Being prepared for emergencies is quite critical as well. This includes responses to fires or explosions. In the lab, for example, we have the potential for a gas explosion. We have gas cut-off valves, and you'll see them. I'd like you to take note of them when we're in the lab. Procedures for earthquakes or floods. How to deal with a robbery. Cooperate is the best advice I've heard in a robbery situation. Don't give the person any reason to injure you. How to deal with gas leaks or electrocution. And these are first aid issues as much as anything else. I'll just say this with the gas leak. If you can turn the gas off, you've got to do that straight away. Dealing with serious injuries. dealing with hazardous substances and spills, and also civil defence emergencies such as pandemic. For each of these different types of emergencies, you should have a response plan of some sort, and it should have some detail at least at how you're going to actually respond, what actions should be taken, who's responsible, who'll provide a backup in their absence or incapacitation, and all this essential information is listed in some place that's accessible. I'll give you an example at NZCAC. We have a fire plan for our building. We have different people designated to clear different floors. We have someone designated to make sure the fire department has been called. And these are the sorts of plans we're talking about, for example, to deal with a fire alarm in our building. That's just a little example in a working situation. Animals can be particularly hazardous. The first thing to note is don't assume that any situation is safe, and you need to learn a range of handling skills and safe practices which will correlate to the sorts of animals you're handling. So large animals such as horses or cattle can be quite dangerous if they're not properly handled. You can see a good example here of people working with large animals in a race, and the race is designed to isolate the workers from the animals, directly speaking, and minimise their hazard. We've got a dangerous looking dog here, and this is something you probably will need to learn in some cases, is how to interpret the language an animal is giving you. This dog's saying, back off, you're giving me a lot of bother, and if you get any closer I might bite you. And you should learn to read that in the animal's demeanour if that's the sort of hazard that you're going to have to deal with. The environment can have a lot of different hazards, all sorts of natural or man-made hazards. So man-made hazards include chemicals, the quad bike, the classic quad bike there. I think the dog's obviously the driver. Anything in your workplace that might potentially be hazardous, and this can include just average cleaning substances, if they get into the wrong place, can cause irritation to skin. They can cause poisoning by inhalation or by consumption. So there's all sorts of different issues. The quad bike is a classic situation. We have a terrible rate of injuries with quad bikes, and that's brought about the requirement for training as well as other mechanisms such as safety cages and roll cages. So for example, if you've got a quad bike that's set up with a full roll cage, you don't have to have trained people driving it, anyone can drive it. This particular quad bike, you would have had to have done your 2-week course and be certified to use this quad bike. If you're not, you shouldn't use it. And here's another one. Stressed, aggressive and dangerous people. People can be a hazard. You know that bullying happens. You also know that people can behave rather unpredictably when they're in a stressed situation. So that might be another potential hazard. Hazardous chemicals, quite a frequent issue in a lot of animal workplaces. Some of the cleaning products can be quite hazardous if they're not correctly utilised. In our chemistry labs, obviously we've got stuff that's pretty nasty there too. You need to understand the hazards and where they sit. You need to use appropriate protective equipment. If you're using chemicals, you need to understand how to use it safely, how to store it safely, and how to dispose of the chemical when it's finished. And that includes the container. In some cases, the vapours left in a container can be explosive in their own right. Let's have a look at some of these situations and think about what sort of hazards might be present. We have a vet working on a cow on the right. I think there's an obvious hazard there. So the animal is the hazard. And the same sort of hazard exists in the milking shed, but there are other hazards there too. So there's automated machinery. You need to be clear about how to use equipment in a place like this, and you need to make sure you follow the protocols. Let's think about a more obvious one that you might encounter. Alright, you've been asked to mop the entry hall of the workplace. What sort of hazards are going to arise from that? And who's at risk? And how do you manage or handle the hazard? And there's a fairly obvious protocol here. You're going to put up a sign to show that you've just mopped up the front entrance. And that sign should be left in place as long as the hazard is there. You should also take whatever steps are possible to dry the floor as quickly as possible. As long as this is a public access point, it's going to be a hazard while it's wet. here's another good example, and this could be home or work. So this is the office. What are some hazards associated with your computer and how would you handle them? So I'm thinking here, could be electrical. So if you're working in a big business, they have to have electrical equipment certified on a regular basis. Generally, computers are safe enough if you're working with the supplied equipment that the computer came with, such as the right power cables and all of that. Is it set up correctly? Is your working distance from the computer correct? Is the screen in the right place? Would be a part of that. Is the seat correctly set up? Is it upright? Is the back and legs of the operator supported? Is the keyboard in the right place to prevent fatigue? The backlighting of screens can be an issue, and this is really more about sunshine coming through the window behind your computer than it is a backlit LED screen, for example. Also, if you're working with small fonts, can you magnify them to make it easier? This is a little bit more of a little bit more of an esoteric hazard. It's not quite so obvious. So you've been working 10 hours straight without a break and you're quite fatigued. You've been asked to drive to another job up to a 4-hour round trip. What would you do? This actually comes up reasonably often with people working for places like rural animal inspectors. The police, for example, have laws around this. There are various laws about how many hours a person should work in a row in a given place. The rule of thumb here is certainly not more than 14 hours, but if you're already fatigued at 10 hours, you might ask if it's feasible to have a break before you do the 4-hour round trip, or if someone else could do that instead. Technically speaking, you've already worked more than your 8-hour shift, you've been on the job 10 hours, and it's inappropriate to do that drive if you feel as though you wouldn't be safe. The hassle that comes up here is having a conversation with the manager that doesn't involve you being fired because you can't do the job, and that's a big issue. For example, for isolated workplaces where there might only be one person on call all weekend, and sometimes you might not be able to make that call out if you're in an unsafe condition to drive. I think the important thing is you need to self-assess. Can I reasonably drive this and be safe? And if not, you need to think about how you can minimize the risk, and it might be take a nap and then go on the call out, or assess the urgency of the call out. Can it actually be done tomorrow? So there may be a few ways to deal with it. Nothing is ever cut and dry. We're going to have a few scenarios for you to work through in the small animal unit when we see you on Monday. So just think about how these examples worked, and we'll be applying some of the same situations when we meet you on Monday. Thank you for watching this video. I just want to remind you this was originally a PowerPoint by my colleague Laura, and here's another place you can get some information. This is the best place to go. It is the horse's mouth. Thank you, and please bring your health and safety computer, i.e. your brain, with you when you come into the block course on Monday. Thanks very much.